Larynx. Larynx is the upper part of the respiratory tract. Its main function is to protect the lower respiratory tract so the foreign bodies do not enter the trachea. If a foreign body come in contact with the mucosa of larynx, it is reflexly give rise to violent coughing till the foreign body is expelled. Thus, the larynx is correctly described as the watchdog of the lungs. Another function of the larynx is the production of voice, hence the name voice box. Then the framework of the larynx is composed of cartilage and membrane. The larynx muscles primarily move the cartilage and through them the vocal cord during the respiration and phonation. Then the larynx is located in front of the neck opposite to the third to sixth cervical vertebra in adult. It moves vertically up and down during the swallowing and phonation. In another aspect, it is covered with the skin, fascia and strap muscles, namely omohyoid, sternothyroid, sternocleidomastoid. Its posterior aspect is project into the laryngopharynx. The next one, that is an extension, that is extend from the upper border of the epiglottis to the lower border of the cricoid cartilage. In the upper part, it opens into the laryngeal pharynx through the laryngeal inlet and it is continuous with the trachea below. There is a difference in larynx of males and females. Until the puberty, the larynx of male differs very little from that of the female. During puberty, the male larynx grows rapidly due to the increasing in the size of laryngeal cartilage. The laryngeal prominence, that is the Adam's apple, become prominent in males. The laryngeal prominence is produced due to the decreasing in the thyroid angle. The next one, that is the skeleton of the larynx. A series of paired and unpaired cartilage form the skeletal framework of larynx. The cartilage are connected by a joints, ligaments and fibrous membrane. These are moved by a number of muscles. Next one, laryngeal cartilage. The skeleton of larynx consists of 3 unpaired cartilage and 3 paired cartilage. The unpaired cartilage are epiglottis, thyroid cartilage and cricoid cartilage. The paired cartilage are arytenoid, corniculate and cuneiform. First we will discuss about the unpaired cartilage, that is the epiglottis. Epiglottis is a leaf-shaped elastic cartilage. It forms the anterior wall of the laryngeal inlet. It projects upward, backward and behind the hyoid bone. The next one, parts of epiglottis. It has an upper margin that is broad and free. Then it has a lower end. It is narrow and pointed and it has a lateral margins, that is right and left. Then it has a superior and that's a surface that is related by, that is an anterior and posterior surfaces. The free upper margin and array epiglottic fold bounded the laryngeal inlet. Its lower end is attached into the inner surface of thyroid angle by thyroepiglottic ligament. Anterior surface, the upper part is covered with the stratified squamous epithelium and it is connected into the tongue by 3 glossoepiglottic mucosal fold. The lower part is devoid of mucosa and it is connected to the hyoid bone by hyoepiglottic ligament. The lower end is separate from the thyrohyoid membrane by a pre-epiglottic space which is filled with fat. Then the posterior surface, the lower part is covered by respiratory mucosa and upper part with the squamous non-keratinized type. It is pitted by a small mucous glands and it is pierced by a branch of internal laryngeal nerve. It's present a tubercle of epiglottis in the lower part. The next one, thyroid cartilage. The thyroid cartilage is the largest and most prominent cartilage in the larynx. It is made up of hyaline cartilage. Hence, it tends to calcify and ossify as age advance. In upper margin correspond to fourth cervical vertebra and lower margin to the fifth cervical vertebra. The thyroid cartilage consists of two quadrilateral lamina which meets in the midline anteriorly at the thyroid angle, leaving a thyroid notch between the above. This one is the thyroid notch that is present on the upper part. The posterior margin of each lamina is free and prolonged upward, that is called as a superior cornua or horn, and downward, that is called as a inferior cornua or horn. The thyroid angle, that is called as the laryngeal prominence, is called Adam's apple in male. It is subcutaneous and hence easily palpated in the midline of the neck. Then attachments of muscles and ligaments. The internal surface of the thyroid cartilage is covered with mucosa of larynx. In the median plane, the ligament attached from above downwards are the thyroepiglottis ligament and paired vestibular and vocal ligament on the lamina just beyond the angle. Lateral to the vocal ligament, there is an attachment of vocalis medially and thyroarytenoid muscles laterally. The thyroepiglottis muscle is attached to the lateral vestibular ligament. It is doubtful whether vocalis muscle is attached to the thyroid cartilage. The oblique line, here there is present an oblique line on external surface of the lamina that give attachment to thyrohyoid, sternothyroid and thyropharyngeus. That is a part of inferior constrictor muscle. The upper margin that gives attachment to thyrohyoid membrane. The lower margin that gives attachment to conus elasticus in the midline and to the cricothyroid muscle on the either side. It is the marvel of nature that thyroid cartilage that give attachment to 9 pairs of muscles, 3 on the posterior margin, 3 on the oblique line, 2 or 3 on the internal surface and 1 on the inferior margin. The next one, cricoid cartilage. The cricoid cartilage is the only cartilage of the larynx that form a complete ring around the cavity of larynx. It is considered as the foundation stone of the larynx. Then parts, it has a broad posterior lamina at the laryngeal cavity and narrow anterior arch that is on the laryngeal cavity. So it has a two-part, a broad posterior lamina and a narrow anterior arch. It is shaped like that of signet ring shape. The cricoid cartilage is a hyaline variety and hence prone to calcification and ossification with the age. The cricoid cartilage presents some unique features. The arch of cricoid cartilage is felt in the midline below the thyroid cartilage and to its lower margin correspond to 6th cervical vertebra. At the lower margin of cricoid cartilage, the pharynx ends and esophagus begins. And the larynx ends and the trachea begins. It is the only laryngeal cartilage that articulate with the thyroid and arytenoid cartilage to form a bilateral synovial joint. So the cricoid cartilage is crucial for the movements of the vocal fold. Then attachment of cricoid cartilage, the external surface to cricothyroid muscle and to the inferior constrictor of muscle. Then inferior margin, here this is the inferior margin that give cricotracheal ligament. The superior margin, here this one, the superior margin to the median cricothyroid ligament. Cricothyroid ligament on the each side. Then attachment of the posterior surface of the cricoid lamina, the median bridge to upper end of this longitudinal fasciculus of the esophageal muscle on either side of the median bridge, the posterior cricothyroid muscle. The posterior to the muscular attachment, the cricoid lamina is covered with the mucosa of laryngopharynx, as this aspect of the lamina forms the anterior wall of the laryngopharynx. Then next cartilage is the arytenoid cartilage. Arytenoid cartilage is a three-sided pyramid part. It has a base and an apex. And it has a two process, vocal process and a muscular process. It has a three surfaces, posterior surface, medial surface and anterolateral surfaces. Except the apex, the vocal process which are made of elastic cartilage. The rest of the arytenoid cartilage is hyaline in microscopic structure. Then attachment of arytenoid cartilage. The apex gives attachment to array epiglottic fold, with its contain the array epiglottic muscle. The muscle process project laterally and gives attachment to both lateral and posterior cricoarytenoid muscle. The vocal process project anteriorly and gives attachment to vocal ligament and vestibular ligament. The anterolateral surfaces give attachment to thyroarytenoid and vocalis muscle. The medial surface is covered with the laryngeal mucosa and form the inner arytenoid part of the rima glottidis along with the opposite medial surface. The next cartilage is the cuneiform. It is nodule elastic cartilage with the posterior end of the array epiglottic fold. And the last cartilage is the corniculate. It is the rod-shaped elastic cartilage that lies anterior to the cuneiform cartilage. Both cuneiform and corniculate cartilage support the array epiglottic fold of their side. That's all about the cartilage of the larynx. Then these laryngeal joints. These cartilages are connected by a joints. The cricoid and thyroid are connected by cricothyroid joints. Then cricoid and arytenoid are connected by a cricoarytenoid joints. Then the arytenoid and corniculate are connected by a array corniculate joints. The next one, ligaments and membrane. The first one, extrinsic ligaments. First one is the thyrohyoid membrane. It connects the thyroid cartilage into the hyoid bone. This membrane is pierced by the internal laryngeal nerve and superior laryngeal vessels. In the median plane, the thyrohyoid membrane thickened to form a median thyrohyoid ligament, and the lateral part it is thickened to form a lateral thyrohyoid ligament. This lateral thyrohyoid ligament that has a contain a small nodule of elastic cartilage that is called as a cartilagotracheal. This one. The next extrinsic ligaments is the hyoepiglottic ligament that connects the upper end of the epiglottis to the posterior aspect of the hyoid bone. And the next extrinsic muscle is called as a cricotracheal ligaments. These cricotracheal ligaments that connect the cricoid cartilage with the upper end of the first tracheal ring. Then next one, the intrinsic membrane. The intrinsic membranes of larynx are covered on the inner aspect of with the laryngeal mucosa and the externally by the laryngeal muscles. The quadrangular or quadrate membrane is a fibroelastic membrane stretching between the epiglottis, thyroid angle and arytenoid cartilage. This area lies the quadrate membrane. Its free upper margin, this one, the free upper margin in the array epiglottic fold, while in the lower free margin forms the vestibular ligament, the stretching with the thyroid angle to the anterolateral surface of the arytenoid cartilage. The next intrinsic muscle is called as a cricovocal membrane. It is a triangular fibroelastic membrane that stretches between the cricoid, arytenoid and thyroid cartilage. Its upper free margin, this upper free margin extending between the middle of the thyroid angle and the tip of the vocal process of the arytenoid cartilage, that is called as a vocal ligament. Its lower margin is attached into the arch of cricoid cartilage, this one. The cricovocal membrane of the two sides are continuous across the midline and form the conus elasticus. So that's all about the membranes and ligaments related to the larynx. Then move on to interior of larynx. The laryngeal cavity that is extending from the laryngeal inlet to the lower border of the cricoid cartilage. The inlet of larynx is an oblique opening that is bounded anteriorly by the free upper end of the epiglottis, then on each side by the array epiglottic fold and posteriorly by the interarytenoid fold. That's all about the boundaries of the inlet of larynx. The next one, that is the interior of larynx, that is subdivided into two pairs of mucosal fold, that is an upper vestibular fold and lower vocal fold. Then inside the laryngeal cavity, it is divided into three parts. First one, vestibule or supraglottic part that lies above the vestibule, this area. And the next one, this area is called as a sinus or ventricle of larynx, that is between the vestibular and the vocal fold. Then the third one, that is called as a infraglottic part, that is the part below the vocal fold. Then this one is the vestibule. It extends from the laryngeal inlet to the vestibular fold. Its anterior wall is formed by the mucous membrane covering the posterior surface of the epiglottis, and posterior wall is formed by the mucous membrane covering the arytenoid and corniculate cartilage. The array epiglottic fold that forms the lateral wall of the vestibule. The next one, that is called as a sinus of larynx or ventricle of larynx. It is a deep space between the vestibular and the vocal folds and extends for a short distance above and lateral to the vestibular fold. A mucosal diverticulum is present, that is called as a saccule of larynx, that extend upward blindly from the anterior part of the sinus on each side. The secretion of the mucus glands that contained in the saccule that lubricate the vocal fold, therefore it is called as the oil can of larynx. When the saccule is abnormally enlarged and distances it to form the laryngocele, which present as an air conditioning cystic swelling on the neck. This is an occupational hazard for trumpet blowers and glass blowers in who air pressure in laryngeal sinus reaches to a very level. The next one, that is the vestibular fold. The vestibular fold are called as a false vocal cord because they do not take part in phonation. They are a flexed fold covered by respiratory epithelium. Each vestibular fold contains vestibular ligament and submucosa with the capillaries and mucous glands. The vestibular fold appears pink on laryngoscopy due to the presence of capillaries in the submucosa. The space ends between the right and left vestibular fold, that is called as rima vestibulae. Rima vestibulae. The next one, the space seen in between the vocal fold, that is called as a rima glottidis. The vocal fold are called true vocal cord because there is a movements are responsible for the phonation. Each vocal fold contains vocal ligaments and vocalis muscles. Due to the absence of submucosa, the stratified squamous non-keratinized epithelium tightly covers it. The lack of blood capillaries and the type of covering epithelium give the vocal cord as a characterized by pearly white appearance. The cords are nourished and lubricated by mucus secretion of the glands in the saccule. A narrow slit-like space that is enclosed with the vocal fold is called as a rima glottidis. The rima glottidis is the narrowest part of the laryngeal cavity. Its anteroposterior distance is 24 mm in male and 17 mm in female. The rima glottidis bounded laterally by the vocal fold, vocal process and base of arytenoid cartilage, anteriorly by the thyroid angle, posteriorly by the interarytenoid mucosal fold. Then parts of rima glottidis. It has a two-part. Between the vocal fold, this space that is called as a intermembranous part. Then between the vocal process and medial surface of the arytenoid cartilage, this part is called as a intercartilaginous part. The intermembranous part that contribute the anterior 3/5 and intercartilaginous part contribute to the posterior 2/5. That's all about the interior of larynx. Thank you.